Hello, and welcome to week 5, employee compensation. So, Christina, this week we are going to be talking about employee compensation. But in addition to this, when you read chapter 16 in pharmacy management, we're also going to be talking about, employee appraisals, employee measurements, which when you are in your midterm final project, you're going to be developing a compensation package for your new job, for your strategic plan, and also developing what metrics you're going to use to evaluate that. So this week is going to help with that. Last week we did the HR where you had to write a job description. This is going to add on to that. And also to what this week, you're going to have this online lecture. You're going to have a YouTube video vignette, and this is on labor costs and pharmacy owner compensation. Now, this comes from Sykes and Company, which is a CPA firm located in North Carolina, and they mainly deal with large independent pharmacy clients. And one of the things, the reason why I wanted to expose you to this is a lot of times when you're working in the corporate world, unless you're up in that area, you don't always have exposure to, things of thinking about salaries and developing those packages. And so hopefully this week, whether this is something you'll be involved in the future, but one of the things that as a manager, you're always going to be involved in is in the retention and recruitment of employees. And so I have attached 2 PDF readings on Canvas. One is retention recruitment of employees, and then the other one is a Harvard review case, which talks about an employee developing their compensation package for a large corporation. We will actually use that Harvard Business Review case to discuss when we meet via Zoom, and I'll be reaching out to you to see when's that best time for us to meet. In addition, there's 2 online reading links. They're very short, but I thought they're very relevant to what we're talking about this week. And one is just a good overview of employee compensation, incentive, benefits, and strategies. And then the other one is talking about how to negotiate a salary. For the assignment this week, basically, there are discussion questions from the Chapter 6 appraisal chapter that I would like you to review and complete. I have that in a Word doc that you can download and use. In addition, please review the Harvard review case. I have some questions for you to consider when we have our discussion about that. And then the final thing is begin to use this week's lecture and material so you can start adding that to your final project that will be coming up at the end of this month. So for all companies, whether they're large or small, the biggest thing is wanting to attract employees to want to work for you. And then one of the other hardest things is retaining employees. Because once you attract an employee and hire them, think of all the time it goes into the training of them and getting to meet the needs of the mission of the company. But then if that person doesn't stay or you have a high turnover rate, then that is become a very costly thing, both to being understaffed and also having to put more training resources into that. So as we market for employees, whether it's the pharmacist or all the way down to the clerk, we want to be able to find good employees to meet the job description at hand, but also that we can provide satisfaction for those employees, that they will want to still stay part of our team. And we want to be able to motivate those employees. And that's so important in leading them every day, but also in making sure that when we do their appraisal, their reviews, what can motivate an employee? So there are benefits I give you from my perspective of working for just small companies. A lot of times from a small company standpoint, we have limited resources. We may not have a very robust healthcare plan or a robust compensation package. So what are some of the things that I need to think about when I am recruiting employees? One is things of value. What are things that employees value? Most employees want to be able to work for a company that satisfies the needs of what they want to be able to do for society, whether it's their professional career that they had gotten this degree like a pharmacist, or it's somebody who wants to work in healthcare as a technician because they want to help people. But then the other thing that sometimes people value is, the employer respecting them in terms of their family life, giving a more flexible schedule. One of the things that, as a smaller company, we don't have long hours. Most of our businesses close either at 6 or 7 o'clock. We are closed all major holidays, and our Saturdays and Sundays are very limited hours. And so we may not be able to compete with higher companies in terms of, sometimes the healthcare packages or some of the other benefit packages. We are able to give them a quality of life from a scheduling standpoint. Other incentives that smaller companies sometimes can do is maybe they can't do a large bonus package, or maybe they're not able to give super increases in pay. But we can have different programs where if we enroll so many people into MedSync, or we meet our immunization numbers, that some of that revenue is shared with the employees. And sometimes the simple things as just employee recognition, that they are doing a good job, talking to them, not just on a yearly review, but on maybe a monthly, quarterly, just providing feedback for that. I find that a lot of times employees are not always thinking, yes, compensation is important, but they also want to be able to have a good quality of life, and they also want to be recognized by their employer. So when we look at wages versus salary, wages generally refer to the hourly compensation paid to operating employees. The basis for wages is time. Most employees in the pharmacy world, unless they are in management, are based on an hourly. And one of the things I've always stressed in teaching business of pharmacy to pharmacists or other non-pharmacists, that when you're running a community pharmacy, the two most expensive things to operate that pharmacy is your pharmacy inventory and your wages. And so pharmacists, which are at the highest end of the wages, and you want to shoot for a goal of your wages are at least 11% towards your sales, that it's important that you focus on your pharmacist and everybody on an hourly basis, not a salary. There are lots of different rules and regulations of what salary is. And salary is income paid to an individual, on the basis of time. And so, people that are salary versus hourly, salary usually have to have some type of management role for that. The other struggles we have in wages versus salaries, and just in general both, is the maturity curve. There is, a schedule specifying the amount of annual increase a person should receive. And depending upon the company, the job, this is usually done on a yearly review. And most employees, in some company structures have at least looked to expect maybe a cost of living pay raise increase. But one of the things that's happened over the least the last 5 years in community pharmacy, we've kind of seen a wage freeze, and we've almost seen wages go down, especially in the pharmacist realm. Now, the main reason for this is the effects of reimbursement we've seen in the pharmacy world. The other thing too is, when does somebody max out on where their salary is? The one nice benefit of pharmacists, when we first start, we do get a nice large base salary. But unless we move into management or to upper areas, that salary can flatten out. And the only time those salaries sometimes do increase when we see a shortage of pharmacists, or we see, a need in a certain geographic area for that. So salaries can be based on geographic areas and can be based on the needs to fill that. A lot of times you'll find salaries of pharmacists and other employee wages to be higher in rural areas versus urban areas, especially urban areas that have, access to pharmacy schools and other healthcare professional schools. But at the same time, I think it's important in a corporation that depending upon the job description, you have a ceiling of the max somebody can make. And the only way they can increase their salaries may be by moving up into the company. And so, for example, in our small 7-store chain, we have the entry level clerk, cashier. We have a clerk slash field clerk job position. We have an order entry technician, and we are now looking to develop a more clinical role technician. And so there are different aspects of that technician job description where they will flatten out on where their salary is, but they can move up into that. Unfortunately, right now in our pharmacist structure, we don't have that, but something we may think about in the future. When we look at payment, there are things that, why do we pay people certain things? Think about the pharmacist. We are not paying just for their skills to fill and distribute a prescription, but we're paying for knowledge. All right. And so a lot of times, knowledge or your experience can affect the compensating of employees. So an entry level pharmacist coming right out of school versus a pharmacist with years of experience, contacts, may warrant a larger wage. The other thing that we have to think about too is skill base. We may have pay rewards for employees for acquiring new skills. And so, one of the things we also do in our technicians, state of Pennsylvania, it's not required to be certified as of right now, but we do have our own internal certification program. And once an order entry technician reaches that, they see a bump in pay. And then once they get certified in the national level, they also get a bump in pay. And so we do have pay rewards within our system. And so you may have pay rewards to your pharmacist, especially pharmacists who are getting more involved in clinical roles. So pharmacists that get certifications to be clinical providers, whether it's diabetes education, smoke and cessation, there may be pay rewards for those because you can do more with that employee. You can get more resources out of them, or even maybe be able to pay for resources, such as somebody that becomes certified to bill for smoke and sensation offers more value to the company. And so you're going to be able to bring other wages in, I'm sorry, not other wages, but other payments in. Therefore, some of that could be shared with that employee who has those skills. So it's always important when we're developing compensation packages or developing job descriptions and how much does that job get paid, we have to think about the knowledge that person's bringing into that. Other factors that determine pay, job duties. And as last week's assignment, you are writing a job description. And, the job duties also determines classification as either exempt or non-exempt. All right. So non-exempt employees are your mainly hourly employees. They are eligible for overtime pay for hours worked in excess of 40 hours. Employers must have a record of time worked using some type of time clock to be able to do that. Exempt employees are typically executive, professional, or administrative positions. They must have minimum weekly pay guidelines, but in most situations, they're not entitled to overtime. And so for this to occur, they must meet both salary tests and duty tests. And there's lots of different laws to protect employees from salary, because sometimes, if the employee who becomes salary, it's nice that I have guaranteed wages, but if I'm working way beyond what is required of me, then if you average out what their hourly wages, it may be a lot less than if they were an hourly employee. And so there are rules and regulations that have to be met by HR to determine exempt versus non-exempt employees. So what other things can determine pay? There are some other employer considerations where employees compete for talent, local and national. All right. What talents an employer competes for, the skill, the knowledge level. I can remember back in the early 2000s when the PharmD first came into existence, that, that is when we started seeing really big increases in pharmacy salaries. Starting out in 1993, when I first started out, my first paying pharmacist job was $21 an hour. And that was big money back then. And then from that same salary in 1993 to just 7 years later, actually more 2001 is probably when we saw it, is that we were seeing a boom in pharmacy build in community pharmacy. You had multiple more chains. You had the expansion growth of CVS, Eckerd, Rite Aid, Walgreens, and they couldn't fill pharmacist positions. And because we transitioned, most schools transitioned in the late 90s from the traditional 5-year program to 6-year, there was like a year of non-graduates. And so we saw a big boost in that. And so that is when, the demand for employees, the need for them far outweighed, you know, the number of people we could get for that. And I can remember I managed a long-term care company I told you back in the early 2000s. And to retain employees, to compete to get employees, because we were also in a geographic rural area, it was very challenging. We had to offer extra hourly salaries. We had to offer some other flexible schedules to make it more enticing for them. And so one of the things too is, as an employer, you always have to think about, how do you want to strongly compete in the job market? Do you want to be the leader in the market, the leader in the highest paid salaries? Do you want to at least meet the market equal? Or do you think you can lag in the market due to your geographic area? There is more, you know, people in that skilled position than there are jobs. And so that all determines all those different factors when you're considering that. And so when you read the case review of the Harvard Business Review, you'll see that there's an area there where they're looking at and comparing salaries. And one of the things too is when you're doing job negotiations or being able to be hired somewhere, a lot of people themselves on the other side need to learn that this is the time you can ask, possibly, if you have the skills that you are bringing to the company and the knowledge level, that you may be able to ask for a little bit more pay or a difference in benefits. Because once you're hired, depending upon what happens, you're then, it's a lot harder to ask for those. Other factors that determine pay. As I said, chapter 16 will talk about appraisal. In your strategic plan, you're going to talk about how you're going to measure the success of those in that job description. So, job evaluation is the method for determining the relative value or worth of the job to the organization so that the individuals who perform that job can be compensated adequately and appropriately. So, what is your system for rewarding or doing pay increases for a person? Sometimes companies just have a flat out that this is the percentage everybody's going to get. Some use a point system on determining for that. Sometimes, too, you need a classification system that groups sets of jobs together into clusters and they're graded in a certain scale. There are different ways to evaluate salaries out there in the market. There's different companies, salary.com, a couple of them that will do surveys of what our salaries are that are out there to make sure that you are being competitive when you're recruiting. Most people don't always look for what is the um, job market is out there, especially smaller companies, until they actually have to go out and replace an employee. If you go years without employee turnover, which you can see sometimes in smaller companies, that sometimes it's a sticker shock when they find out what the value of that is. I know when in my prior life as an academic, when you were hiring new faculty, you were always comparing that. And the American Colleges of Pharmacy released every year what was the highest paid salaries in different positions across the country, what was the medium, and what was the lowest. And every company has the determination of where that's going to be. But then the other thing you have to determine is how much do you do a pay increase? Because if you do a pay increase from, the average cost of living is an increase of 2.5, but you want to reward good employees, you may do a pay increase from to 4%. Five's probably pushing it anymore. And that can have a big impact if you do that every year for a good employee. And so there might be times where you have to cap them out, or you have to challenge them to take a higher position in your company. So that is why determining pay is such a very difficult thing. So when we're trying to develop a compensation package, all right, compensation packages, include many things, all right. You know, you need to have a way to reward and recognize an employee, whether that's on the yearly appraisal. What are the benefits that employee might receive in terms of healthcare, paid vacations, retirement, stock options if it's a trading company on Wall Street? What is the job classification? All right. What does that compensation structure look like? All right. Is there bonus pay available for this type of position? So all those things fall into play in developing a fair compensation package. And compensation is yes another word for wages, but it is more than just getting the base salary. It may be those additional things such as your work schedule, your healthcare, your paid vacation, whether or not you had dental or vision in your that, whether or not you're offered a 401k, whether or not your employer matches your 401k, whether or not you have the ability to receive life insurance or you have the ability to purchase more, and what are the benefits that if you have a family that you can offer in this compensation package. There are legal issues also in compensation. All right. There, we have to always be consulting with our HR managers. And if you are the HR manager or you're a small company where you wear many hats, consulting outside sources to make sure. There's the Fair Labors and Standards Act of 1938, which basically set us the minimum wage. And the Fair Labor Standard Act includes provisions for the minimum wage, what requires overtime, and child labor. The other thing, too, is what requires full time based on the state laws and federal laws. And HR managers must adhere to overtime laws because if not, there are legal ramifications an employee could take against that employer. So, as I said, there's the Fair Labors and Standards Act. There's the Employee Income Retirement Security Act. We have Age Discrimination and Employee Act. And so, if you look at actually Chapter 15 in the pharmacy management book, it goes over all this. There's the Family Medical Leave Act, which the Family Medical Leave Act doesn't say you have to compensate that employee leaving for time off, whether it's for a maternity or some type of illness in the family. But a lot of companies do want to retain good employees. So sometimes they'll pay for at least 6 weeks of their initial salary, and maybe not the full salary, but a base. Some will actually pay it, but they'll also make that employee have to take so much of their time, paid vacation time off before they can do that. So, it's real tricky and real important that HR is following all those. There's the Economic Growth and Tax Relief Reconciliation Act. Obviously, we have to HIPAA, and there's many more. Like I said, there's laws and laws and laws. And as a manager, you may not be the one that needs to know all those laws and follow them all the time. But when you're developing a compensation package for an employee, you're going to be consulting HR on what you're allowed to do and what you're not allowed to do. There's also pay compression and pay inversion. Pay compression occurs when individuals with substantially different levels of experience and or performance abilities are being paid wages or salaries that are relatively equal. All right. So, sometimes, some people have higher pays just because of years of experience. And is that always fair, especially if somebody you're bringing in has more skills, but maybe not as many years of experience? Pay inversion occurs when the external market changes so rapidly that new employees are actually paid more than experienced employees. This actually happened in the early 2000s when, to get pharmacists to come to work, that you were seeing new graduates being offered bonuses to go to different geographic areas here in the United States, and also higher wages. And so how do you bring up all the other wages to do that? And so these are challenges that we do have in companies all the time in dealing with pay compression and pay inversion. We also have to know that in most compensation packages, there are mandated benefits, such as unemployment insurance is a mandated protection plan that provides basic substance pay to employees who are between jobs. And recently, with the recent, pandemic and COVID crisis, some of those laws have been amended so that, employees that don't work full time or are working on base pay, like, the restaurant employees, that there are ways in the way that they can be structured on how they get paid and how they are employed, that they can still receive unemployment insurance. Social Security is another thing that is a mandated benefit. All employers have to pay into that, for that, and along with workers' compensation insurance. Those all are mandated benefits that everybody gets. Now, it's the non-mandated benefits are the ones that you might be able to attract employees, future employees, over another company. And that might be your pension plan or your 401k plan. And the defined benefit plans, a private pension plan where the benefit is precisely known based on a simple formula, such as years of service, or there's contribution plans, such as 401ks, where the employer will match. One of the things, though, we've seen due to the pandemic crisis and due to different types of employers, if you follow in the market, there are some even large corporations that have stopped matching their contribution plans. And so it'll be very interesting to see how some of these compensation packages look like, if they go back to the way they used to be, and what will happen in the near future as we slowly, hopefully, get out of this pandemic. Additional benefits that might be put into a compensation package are wellness programs. Wellness programs are a win-win for both. One of the most expensive things for any employer is healthcare benefits. The CEO of Toyota one time made the comment saying that, you know what, we are a company who gives out health insurance, and on the side we make cars, and it becomes a very costly thing. And so one of the things that employers try to do is offer wellness programs. They may offer discounts to gyms, or they may offer different types of companies coming in to talk to them about stress release. They also will simply pay expenses when they do become ill. Childcare programs to help assist parents that, sometimes we lose, especially this past year, how many, employees that I lost or had to restructure schedules just because they had to stay home due to kids not going to school. And there's also additional benefits, can be cafeteria style benefits, that if it's a small company that can't afford all these benefits, but they can maybe pay half of it, that the employees can choose the benefits they really want. And yes, they may pay a little bit of that, but the employer is also going to pay some of that. And sometimes that would be cheaper to buy through the company versus they bought it individually, such as another one is example, additional disability insurance, professional liability insurance, other additional healthcare benefits such as dental and vision. And so they can be cafeteria style. And this is another way to attract employees, and especially small companies. The cafeteria style is a way to offer things, but not to be too costly. And so when we look at core versus non-core, most companies, the core benefits traditionally are health insurance. And, based on the size of the company and with the Healthcare Portability Act, Obamacare developed in 2010, insurance, based on number of employees is a mandate. Most employers do cover prescription drugs, but over the years, we've seen that these medical benefits have changed where patients are paying more out of their pocket for that. So those can vary based on coverage. Basic life insurance, so much vacation pay. That's another compensation to think about. What is the max in that position can somebody get for vacation pay? Because that becomes a costly thing as an employer, because if you've given out so many weeks and you only have so many employees, how do you cover when people are on vacation? Holiday pay, sick pay, and disability. Things that are non-core, voluntarily and elective. And this is where developing a more rich compensation package is dental, vision, supplemental life, long-term care insurance, autos, home owners insurance, mortgage services, on-site daycare, tuition reimbursement. And yes, I've even seen some health, employers offer pet insurance. Some of this has changed, especially since the pandemic. Not all companies are able to offer all these benefits, but they offer it as a cafeteria type of style, as I said earlier, because they want to be able to show that you could get these through us, and it'll probably be cheaper if you were building out. The health benefit side is the medical, prescription, dental, and vision. Because a lot of smaller companies, the premiums have gone up and they've had to share that. My very first two jobs I had coming out of school in the early 90s, I didn't pay anything for my healthcare benefits. The employer paid for all of that. But we didn't see that in the 2000s. Healthcare became so expensive that the employee does pay a percentage of that. Obviously, the bigger the company you are, the less you may pay because there's a bigger pull. One way smaller companies have offset this so that the employees not paying as much is developing health savings accounts. And health savings accounts, sometimes maybe the employer will contribute so much initially, and the employee can then take so much out of each pay, and it's non-taxable. Most health benefit employee contributions that are deducted from pay are pre-tax, and so that does help, in making a more attractive compensation package by offering it that way. The retirement benefits, those have changed over the years. Traditional pensions kind of have disappeared, where the more popular is different types of 401k or 403bs contribution plans. But like I said, those contributions or those matchings have gone down over the years. But if you're working for a larger company, sometimes those 401ks can be very lucrative. And so it is beneficial for that employee to contribute to the 401k plan. Most senior executives receive their compensation in two forms. Usually it's a base salary and there's an incentive pay, usually a bonus, which is based on company performance. And so when we're looking to get higher up-end managers, executives, this is the way those compensation packages are done. When you look at that Harvard-based review case of that I provided for you, you'll see that that is discussed in there. So what are employer challenges? Well, challenges are structuring an employee benefit package that meets the needs of a diverse workforce. One size does not fit all. However, when you're working for a smaller company, I can tell you it's very hard, and probably it's the same in a larger company. Everybody still talks. You think people don't talk about what they make or what they get? Everybody does. And so trying to be as fair as possible is important. Also, too, helping existing employees understand the value of their benefits. Yes, they may not be seeing an increase in their hourly wage, but what would it cost them if they were buying their own health insurance on the exchange? What would it cost them if they, were trying to set up their own IRA for retirement? All right. Those are all important things. And all companies have limited budgets. Benefits average 25 to 40% of payroll in most organizations, so it can be very costly. There are also government restrictions, legislations, and public policy that sometimes mandate certain benefits have to be met and given. So companies often have to look at that. And as costs go up and sales or things such as what occurred this past year in the pandemic, those all have an impact in developing employee compensation packages. As I speak as an independent employer, not a chain, there are challenges, but I'm sure they're very similar to the chains. That we're always comparing pharmacy wages to sales. And though 11% is a simple number, you also have to think about the workflow of the pharmacy, the safety of the pharmacy, and just giving out a flat out budget sometimes is not always easy. The other thing is how many employees and what services do we want to offer? What is the structure and the experience of our employees? Some rules we've set in our company is that no pharmacy manager or at lead order entry tech can be off the same week during the year to keep continuity and to prevent workflow disasters. Um, Staffing also can be based on volumes and sales. So, for example, 1,400 to 1,700 prescriptions per week may equal one RPH, and we add four RPH hours per 100 extra scripts per week. 100 scripts equals 10 hours of other pharmacy laborers and techs. There's multiple different formulas out there. And the biggest thing you have to look at, and I can say, is you play with those formulas, you look at safety, you look at are you meeting the outcomes of what you want to measure. That is why strategic planning is so important. That if you're not meeting the outcomes, maybe it's because we're underemployed. But the challenges we have on reimbursements is playing a big role in that too. And so there's not a real easy. Sometimes there's formulas for front end sales, how many dollars for 1 hour of clerk hours. And so I'm constantly rebalancing, relooking at those things. As we are currently in the pandemic and we're trying to go do COVID clinics. And yes, we are being reimbursed for the administration of this. And yes, this is a very important healthcare thing we need to be doing. We also have to look at what are our resources? What are we pulling out of our pharmacies to do this? What are how many employees can we do this? And could this have an impact us on other things we do with our company? So the challenges of employees and compensation is difficult. And when we talk in our Zoom meeting and when you do the readings, hopefully this will give you a better understanding of what has to be taken into consideration. It is not just offering somebody a nice hourly wage is what's going to make somebody come to work for you. Yes, compensation, good, fair compensation is one of the main reasons people do, or one of the main people reasons leave their job. But the other reason why they leave their job is not being recognized for what they do, not being supported for what they do, not being led and giving a directive of what they need to do, as we talked in prior lectures in leadership. So, the last part of this lecture, I leave you with some thoughts. Pay attention to the pay process, perceived fairness of financial rewards. The amount paid to employees typically matters far less than the way pay decisions are made. So, what is your standardization of that? And if yes, you may not want to share all the things that go into that with your employee, but be clear and consistent when explaining that to them. How employees are compensated takes many forms: salaries, benefits, work conditions, challenging, stimulating work. The right mix for each person can be different. Pay policies will differ for every employer. Some focus on cash compensation, others will focus on total compensation. Execs, when you're hiring up, they will be salary based. You may work them a little bit harder in terms of number of hours, to what you are allowed to the extent of the law. But what are some of the other perks and benefits? What are the incentive bonuses? The employer's main goal is to structure a compensation benefits program that is able to attract and, most importantly, retain quality employees to be competitive. Employee benefits have a huge budgetary ramifications, and payroll is a reflection of total sales of the company. It always has and will always be. Benefits are the hidden paycheck for employees. Employees need to understand the total compensation, not just their salary. They need to understand that their flexible work schedule, there may be childcare that they get. What are all the different things? Company car, maybe they get their own phone, their own laptop. They need to be educated on the benefits they are getting. They also need to be educated on the advantages of the things they can take. The more employees that participate in the retirement plan, the better it is for all employees, including the employer in the company. So hopefully this lecture gave a nice brief overview of employee compensation. And please read the readings. And once again, this is going to be probably our last big lecture for the first focus of Management 1. I will be reaching out to you to set up that Zoom meeting. And then additionally, I will also have a small lecture next week talking about DE regulations and also talking about um, the things that differ between retail, independent, and chain pharmacy. Thank you very much and take care.